Welcome to the Getting Started with EBM section of the EBM Express course. EBM Express is designed to build your understanding of evidence-based practice in short, manageable blocks of content. In this section, we'll be thinking about the application of EBM in the context of a clinical scenario. So let's imagine this scenario. A physician who has offered integrative therapies to her patients in the past has a 60-year-old male patient who wants to deviate from traditional treatment for colon cancer. She has asked for your help in finding relevant information. If we think about this scenario in terms of EBM, we have a physician whose experience and training have led them to consider integrative therapies, and a patient who wants to deviate from traditional treatments, and we are looking for evidence that is relevant to the scenario. Now let's consider how we might move through the steps in the evidence cycle. In our scenario, the clinician has assessed that they need more information. They have approached you for help in acquiring that information. Rather than immediately searching for the broad topic of integrative colon cancer therapies, you encourage the doctor to think more specifically about what they already know and what their actual information need is. You encourage them to ask a more specific, answerable clinical question. We discuss how to formulate this type of question in a different section of this course. The doctor reassesses their information need and realizes that they already know quite a bit about integrative therapies for cancer. They now ask you for help in acquiring evidence about the benefits and risks of intravenous vitamin C treatment in a 60-year-old male with colon cancer. Using the more specific details, you do a quick search for colonic neoplasms and ascorbic acid. We'll provide help on finding terms in another section of EBM Express. Your search finds that there have been around 20 articles written in the past 5 years. You send this list of citations off to the doctor, who finds several of the titles relevant to their patient. They decide to read and appraise the full articles. Based on their appraisal of the articles, the doctor decides to apply their newfound knowledge in their clinical care of the patient. In this simple scenario, we can see how the three components of EBM work together to help the physician provide the best therapy for their specific patient. We can also see that EBM is flexible and does not always move in a straight path through the steps of the evidence cycle.